think so. You mean you don't want to look at the dog anymore?
So what happens when you give me control and let me work on the slides.
How do you go back on PowerPoint?
All right. So the guidance uses terms like reasonably foreseeable, and if you like looking at case law, even that is an interesting terminology. And what I was getting at is GAMP is already, remember, even if you look at the disclaimers in the guidance documents, it's like, hey, these are recommendations that you must comply with statute and regulations, as opposed to the GAMP guides. Plug-in GAMP again, of course. Data integrity by design has everything that was in the CSA appendix and more. Enabling innovation goes in depth on critical thinking, and then GAMP 5 itself rolls in and gives you more context. We're also supported by other documents that have been published. The first and foremost, probably the Gartner document that you can use, and I recently used in conversations with my CIO. Oops. So if we go forward one slide. So we are the dog that caught the car. And now what do we do with the car? Right? This is where we have that moment. Well, before we go to Disneyland, we have that moment when we caught the dog. We could keep doing what we have been doing, or we can take a moment and really evaluate where we can be or should be. I see a lot of webinars and a lot of content that's just rehashing the past. Now, there are elements that we've always said there, but this is an opportunity where we really can look. Again, it's not the fantastic development administration or agency. It's the Food and Drug Administration. Software engineering is not their forte. Okay? This is where GAMP is taking leadership and created documents, but we can, as the technology evolves very, very quickly, this SIG has the opportunities where we can tap into the leadership, tap into the people, and make things happen. So, not to go forward, next slide, please. This is what we do when we celebrate. We win the Super Bowl. What do? We win the World Series. We go to Disneyland. So, if we go forward one more, we're specifically going to Tomorrowland because this is where we want to be. We want to look at the future. Now, the plug for the annual meeting and expo, I believe 4 of the 5 SIG leaders, I believe Ray is the only one who can't make it, will be there helping with a workshop. So you can come meet, talk, go through your specific issues that you have, and we can work through them during the session, offline. If they tend to be longer, we can network. So definitely encourage everyone in the SIG especially to come to this meeting. So go forward one. All right. So this again is the CSA draft guidance document. That's where it's at. If you can click on that link, you'll be able to make comments. So if you go forward one. So this is a place where you can submit the comments, but at the time of I downloaded this, there are 45 comments downloaded. You can actually go and read what other people are saying. Now, one of the things I would like to emphasize, and it's the government's not going to be like, say, Lori or Charlie, where they take the time to go like, Ken, what did you mean by this statement? When we were working on documents, to get your comments to be more meaningful and read, you need to write them. It currently says A, it should say B, or did you mean this? So something that makes it easy is more likely to get considered, as opposed to I don't like this, or those non-constructive things. Think of this as, dealing with your spouse or your kid. Everything needs to be constructed and framed. This is behavior doing, this is behavior I would like to see moving forward or stop, etc. So,
and I would also, sorry to interrupt, you knew I had to. I would also suggest adding some context if you feel that there's context. Like, I don't want A, I want B, and the reason B makes more sense is for this rationale, so that you actually give a lot of the context behind what your thinking is, instead of just saying you did this wrong.
Sounds like Lori's been abused by my comments where I just initially left this like, hey, I put these statements out of context and Lori would have to call me. It's like, what did you mean? So definitely it is, we want to make sure the ideas are captured. Now, we're not saying submit here because when we get towards the end, there will be a slide where we talk where we as ISPE can consolidate and bring our voices together and make a larger impact. So if we go one slide forward. All right, so this is something, a couple things I wanted to point out that came up. Everyone's like, hey, it's biologics. If you, and CDRH, if you actually read the footnote, right, it's CBER, CEDAR, OCP, ORA, that everyone has collaborated on this document. So, and I would like to again point to scope and application, which says specifically for further guidance on validation. Okay, points to CDRH and it points to GAMP. So I just wanted to get there because some people are saying like, well, this is biologic, doesn't go to drugs. No, it's directly applicable. So if we go forward one more slide. And right, read, you can use an alternative approach to satisfy the requirements of the applicable statutes and regulations. This will always go back why Cisco said, you know, I think the very first time I met him, we never told you had to do it this way. Right. And then the other statement was followed by essentially, we never, in full transparency, was something along like, you know, we never told you you could do a different way. But in actuality, they did, because the statement alone tells you that you can. And this is where GAMP does a great job of giving you a framework. If software engineering is not your forte, then you can look at GAMP to see where people have taken practices from software engineering and kind of pull them forward, and you can have a nice reference that does meet the documented and you know, justifiable approach that they're looking for. If you look at Annex 11, you must be able to justify your val plan, your val strategy, etc. So you could do that, but you can also, you know, develop your own with the principles that you learn. But I recommend that you build it off of something else. So if we go forward another slide. Right, so this is, I think maybe if we could just go through, I think there's 4, yep, there we go. Right, again, these are the foundational documents that we can leverage to come up and help build for yourself. Because the reality is this is, you know, we should be self-interested as well as externally interested. So self-interested to build up something that works for you. And this is the key part that I must emphasize. It needs to work for you. Just because we published it may not work for you perfectly. You need to actually take that moment, apply the critical thinking, and make it your own and move it forward. So if we go forward another slide, I believe this is where I was going to stop for questions and comments, but I wanted to go one more slide and we can come back to this slide. I know, Charlie, you wanted to speak about the ISPE Engage?
Certainly do. Thank you very much, Ken, and hello, everyone. So Ken touched briefly on the opportunity to comment on this document. And we saw that everybody has the opportunity to comment as individuals through the FDA website directly. And, you know, whatever you like or dislike about this guidance, you're very free to air your views to FDA through that forum. As ISP members, there is also the opportunity to put forward comments for consideration to go in as part of the official ISP comments. So you can see here there is a posting on ISP Engage in the open forum telling you where to download the comment template from ISP, telling you who or which email address to send your comments too. Now, if you want to comment as part of ISP, as part of a larger respected industry association, we will be scrutinizing comments very, very carefully. In the case of commenting to the regulators, it is a little bit of a less is more. If we put in, 386 comments about every piece of grammar and punctuation and possible nuance, then, the important comments would get lost in the white noise. As individuals, your opinion is your own. You can have whatever opinion you wish. As ISP GAMP, we are very committed to supporting CSA, the great collaboration with Ken and the other FDA industry CSA people, the guidance we've already published in the different GAMP guides. All of these things reflect our commitment to CSA, to making it work, to encouraging industry to think better, critical thinking, but also good dose of common sense about how to do validation so that you're truly getting a system that is best fit for intended use. So be aware that, we are looking for comments. And Marcy, if you could click once, please. We're going to be looking and judging your comments to say, if we put this comment forward as part of the ISP comment, is it really going to bring a benefit to optimizing the guidance? So if it's just that you don't like a phrase or you think they should have talked about something else, then that comment's probably not going to go through. If it's a comment that's really bringing an insight, that's really bringing an opportunity and a recommendation and a practical suggestion how FDA can improve that guidance, how they can make it more impactful, how they can make people maybe braver to implement this kind of approach, that's great. We will be hugely supportive of those comments. So all the comments will go through to ISP. There will then be a comment review team comprising ISP regulatory affairs and key members from GAMP to look at those comments in the context of, is it going to bring a real benefit to the guidance if FDA accepted this comment and implemented a change accordingly? Now, one thing I have seen a lot of discussion about, people posting on LinkedIn, is about the applicability of this guidance, because I think all of us in industry, or most of us in industry, really want this guidance to come through and, maybe revolutionize how people approach validation for intended use. And I've seen a lot of folks going, oh, it just says CDRH. It's everything in the guidance is about medical devices. It's quoting 21 CFR Part 820, but it is not talking about 21 CFR Parts 210 to 11. So does that mean that we can't play as pharma? And within GAMP, we have a very expert founding member, Sean Wynn, who worked with FDA on the 21 CFR Part 11 scope and application document and has a very good handle on how the different FDA structures work. So we saw that extract in Ken's slide, that it's produced by CDRH and the Center for Biologics Evaluation and Research in consultation with CDER, Drug Evaluation and Research, the Office of Combination Products, and the Office of Regulatory Affairs. The draft guidance is very clear. It is looking at the validation requirements of the medical device quality systems regulations. And it is aimed specifically at organizations that are manufacturing devices regulated by CDRH or CBER, because CBER, Biologics Evaluation and Research, regulates medical devices that are related to licensed blood and cellular products. So if you look strictly at what the draft guidance says, it's not directly applicable to pharma and biopharm. However, if we look back historically, the general principles of software validation from FDA also was issued out by CDRH. And yet we know that the other FDA agencies do refer to the general principles of validation that came out so long ago. We know that, for example, it says in the draft guidance webpage for FDA that this CSA guidance is intended to supersede Section 6 of that General Principles of Software Validation. So the fact that other agencies work from the General Principles of Validation and this CSA guidance is there superseding one section of it suggests there will be some reference, some leveraging across the other agency areas. We've already seen other FDA divisions, including the Office of Regulatory Affairs, being very publicly supportive of the CSA guidance. We've heard from Senator Toms of the ORA talking about what a great thing CSA is. So even though maybe some are disappointed that it doesn't explicitly say, this is covering pharma as well as devices, I think it's laying a great foundation for giving us all really freedom to operate in a more effective manner around validation. So that's me off my little soapbox. I'm going to hand back over to you, Ken.
Yeah, so Charlie, I think it's something that we're both are definitely reinforcing now. Just to add on to Charlie's point, scope and application, which points again to, well, specific CDRH and general principles of software validation. Charlie already covered the relationship. That was approved by all the centers. So you're going to see CDER already signing off. So you've already got it. But then, so let's take a step back. So let's say like, okay, I still don't agree. What is your basis for doing what you do now? 21168? It just sits there like, hey, you should verify your input outputs. You should have backup. If you're really looking at the pure compliance aspect, which is again, statute or regulation, you're going to find very little that tells you how to do it. So in the absence of that, why not this? This is a common sense approach. This is looking at GAMP again, gives you the framework where you have the ability to leverage more and understand more, right? You can stand on the shoulders of others, but you can also go out, especially when we're in a DevOps environment and technologies and approaches are changing, you have that flexibility. But most of us in pharma, we're not here because we're software engineering experts or want to pursue that. And in that case, guidance is guidance. GAMP is another perfectly good way to leverage it as well and help you develop a common sense approach that is easily justifiable and can be followed and understood. All right, so if we can go back one slide. All right, so for the rest of the session, it's really questions, comments about the process, about the document. Kind of wanted to open it up and just hear what people are thinking. I mean, you heard where we were at and what our next steps are ultimately, and Charlie pointed out the timelines for GAMP, and then if you wanted to submit individually, there's also the aspect. So just going to open it up at this point. No one?
Good day, Ken. Nobody is speaking. Can you hear me?
Yep, can hear you.
Yeah, okay. Frans Boyen, speaking from the Netherlands. I've been studying the document and I understand the explanation Charlie is giving about the applicability, but I'm still struggling when I'm reading the document how to post my comments, because I can read it as a strictly medical device regulation and make comments to that, or I can read it as we would like to have it, being more broader applicability. So it makes a difference on what level and what detail the comments are made. So as I understand from Charlie, this is a medical device regulation. So should we only comment it in that respect to A20 only?
So it is, sure, it's a medical device. Well, it's a 820. If you're going the regulation. This is, well, I guess I'm getting hung up in my head on this. This is a guidance document, so it's neither a regulation. It is right. It is purely guidance that is telling you how to do it. And what it is talking about the non-product systems. So one of these interesting comments that we had in Fixa early on when I was first there, and they're like, hey, you're pharma, we're device, why are you here? Was a point that I pointed out. It's 100% applicable to pharma because we don't make medical devices. Right? It's all of the systems that we have. It's more applicable to us than them, frankly. So in there, my recommendations, the way I've always viewed this is it is talking about what we share in common, which is all the non-product systems and how you implement them. So your comments should be focused on those that are the common, and should be looking less about the 820 itself. And if you even look at 820, if you really want to go 820, 70, it just says like, hey, you need to validate. I mean, so this is one of the things when you actually look at what is true compliance, whether statute or regulation, it's just going to say you have to do it. This is one way that you can do it, and if you choose not to, that's another way. But it's where people get hung up on. This is like the Bible or the the Bill of Rights or Magna Carta, whatever. Everyone gets hung up on that.
Yeah, I think I understand you correctly. Of course, I do have a little bit of a language problem, despite I'm speaking English, so I try to understand you correctly. But okay, so we should look for our comments to the content and not to the applicability. Whether we are going to apply this later on to products like drug substance or drug products is something different. But for the moment, I understand we have to look at the content only and not to the general applicability, which is very interesting, of course, too.
Yeah.
Am I correct?
Yep, you're correct. And definitely, I know in the interest of time, you can reach out to me. We can have a side conversation on LinkedIn, whatnot. I'm always willing to talk. Now, this is guidance. Even a device company doesn't have to follow this. Right? This is just represent the only people who are mandatory to have to follow any of this is the if you read 21 CFR 10.115 on good guidance, the only people who are mandatory to follow guidance is the agency itself, right? Because it represents their current thinking, and then that they require, I think it was something along the terms of like supervisory, approval to deviate from it. And then this goes back down to where are we with scope and application again, which is still says that we're under enforcement discretion for validation, which means they don't even look at this stuff unless they have a reason. So this is where really it's more important that you look at it from the content to make sure you get something out of it that works for you. GAMP is the same thing. They have everyone publish the 3x3 matrix, M3. And what ended up happening, and Charlie and Lori can back me up on this, that people shut off their brains. People literally shut off their brains and went to the 3x3. They ignored the fact that GAMP already said like, hey, don't take screenshots unless it adds value. GAMP had a section on GAMP 5, the original, had a section on accelerators, like leveraging activities that were done. Much like CSA says like, hey, you can leverage activities done by your developers or your suppliers. My implementation of CSA, what I push for on all the projects, is that we leverage our internal software testing cycle. So, because that works for me, and I think that's where everyone needs to be, is like looking at this, what works for you. So, thank you for asking the question.
And thank you for your answer. Let's other people speak too. Yeah, please.
Okay.
Hey, Ken, this is Khaled. I just want to add really a couple of things kind of related to the title of the draft guidance. So as you may know, since we started back in 2015, and when the very first draft came out, the name of the guidance really focused on non-product software, right? It didn't mention anything about CSA, and then we started looking at it holistically to have it be applied across the life science industry, period. Yes, it's a CDRH initiative. However, and I'm not going to repeat the however, because I know between you and Charlie, you guys covered it. But I just want to share with you the three title of the guidance. So the very first one was validation of non-product software. Then we went on to validation of automated processes, equipment, and quality system software. And then finally, we settled on the computer software assurance for manufacturing and quality system software. So it kept it really general, open, available to the entire life science industry to leverage. Just want to add that tidbits, kind of a little history about it.
Awesome,
That's it.
Colin.
And then ended up with computer software assurance, which upset everybody because it's computer software, not computerized systems. And I wouldn't recommend making that comment to FDA. They're probably so over the discussion of their choice of words.
Well, I actually had the opportunity to have a discussion on some of those kinds of concepts with Cisco, and it was very interesting. And I shouldn't be quoting kind of what he said, but my impression was the idea that we get so hung up, and people who have worked with me for a long time know I often call validation George, because validation comes with baggage, qualification comes with baggage, those terms, and we get so hung up on those terms. And I think some of the impetus to use a different term was to get rid of that baggage. It was almost the George concept of removing some of the baggage associated with the terms.
Lori, please do not recommend George.
I like George.
Okay, you like George, but don't change. CSA is the sexy label for GAMP 5, okay? Let's keep it that
Okay,
way.
okay.
Let me, maybe you guys can answer a question for me too. And, you know, Azure Group's probably going to put together a consolidated comment from our company as well. Can you talk to, in line like 240, 241, it says talks about process risks and medical device risks. So I understand, you know, the process side of things, and then it talks about, is that talking about risk to the product in the manufacturing process? Is that where that's coming from?
I believe so. You gave a specific line, so I need to go look at the line.
Yeah.
If I may share my interpretation of this, this is Flavio speaking. When you produce medical devices, you have separate risk levels for the devices. So I believe that when you say medical device risk, that's what they are saying, right? If it is a risk 1, risk 2, risk 3.
I don't think it was that. Let me.
So I'm just gonna add my 2 cents on here. The reason being, Kevin, this is, you're gonna hear so much more about what CSA is built for, right? Again, CSA is really that critical thinking, risk-based approach for non-product software, right?
Yep.
Enterprise systems. However, the idea of it is to establish that framework, the platform to support any validation activities, right? That supports advanced engineering, that support AI. The idea is to open, you know, to stay away from, again, from George, what Lori just mentioned, is to really leverage risk-based approach, really the whole concept behind it. And you hear Cisco day over day saying the same thing. We are trying to change the mentality, right? Get out of that validation aspect and get stuck in it. Let's focus on producing quality system, quality product, quality data. So that really the idea behind it is that framework, that platform to support many processes. We've seen clients of ours and friends of ours implementing the CSA concept. And now I look at CSA as a methodology, as a concept, right? Strategy. We've always written validation strategy in a val plan for a specific system, whatever the system is, right? You can write whatever you want as long as you follow it and you execute, right? And you have a validation summary report that tells you, you know, what you did and things have passed, right? So really the idea is apply that critical thinking and and again, it's not, you know, we want to really repeat that same statement that we're saying. It's not about cost reduction. It is not about time saving. It's really about moving, moving that time allocated to the paperwork to something better. That's it.
Yeah, sure.
Focus on compliance and not quality. I mean, focus on quality, not compliance. Oh my God.
Thank you, Lori.
Sorry.
Right, exactly. And I think the guidance, the draft guidance is really well written. And I really appreciate the fact that they didn't do a high, medium, low. They just went to like, it either has high process risk or not high process risk, right? One or the other.
That have evolved, by the way. That has evolved multiple times. But again, whichever flavor you're using, it doesn't make it wrong.
So Kevin, back to your question, right? If you read that, you're talking 241 to 243, but if you read the sentence that follows that, right, a medical device risk with potential for device to harm patient or user, and then when discussing medical device risk, the guidance focus on medical device risk resulting from a quality problem that compromises safety. And if you start reading from 247 onwards, that is the context that the document follows. That's why, sorry guys, I always have to go back and read any of these questions in the context of there. And then back to the high versus low, Kevin, they do leave the opportunity for you to define the middle. High and low are always easy to spot. It's the middle that is going to be dependent on your organization. Right. So I think that they did a great job there, but you know, that acknowledging that.
And to everybody's point too, it's like you use critical thinking. Do you want to use high or low or high or not high? Do what makes sense for your company and your culture. Do what you can live with. But yeah, focus on quality, not compliance.
And, you know, we continue to hear you guys did a great job, or the FDA did a great job with the guidance. Just remember, the guidance is the result of 15 folks from the industry, pharma, medical device, biotech, right? However, now we have an opportunity to even make it way much better, right? Is to have the entire industry commenting. But to Charlie's point, it has to be concise, right? It has to make sense. The comments need to have a total open mind about what do you really want to see in the future, right? We can't, and to be quite honest with you, and I keep telling the FIXA team whenever we meet every Friday, you know, guys, I'm getting all these negative feedback on LinkedIn. Oh my God, the guidance is nothing has changed. It looks exactly the same thing, blah, blah, blah. You know, all kind of negative and positive. And really my point is, my response to all of that, great, let's make it better. It's not a great guidance today. I will admit to it. But you know what? We need the positive, open-minded, critical thinking, real risk-based approach, mentality to comment on this guidance to make it better. But at the end, whoever has been saying, yeah, we're not going to apply CSA until the guidance is out. Well, for crying out loud now, we've got multiple guidances out. You've got the actual draft guidance, and in my opinion, we got the real guidance, GAMP 5 second edition. So again, you know, we've got a lot released. We just need to apply critical thinking and move forward.
So Khaled, I disagree with you that the guidance is bad. I think the guidance is great.
I'm not saying bad. Did I say bad? Did I say bad? Why are you putting wood in my mouth?
Okay, so here's the thing. If you really see, you know, this document is after the lawyers got to it.
Exactly.
So areas which were cleaner and clearer were changed. And I do think the a plug back to data integrity by design. You want to see what was there before without all the lawyerification and get a little more meat and content. Go there, go to enabling innovation on the critical thinking section to give further flesh it out. And then you got GAMP 5 second edition to kind of add there for a broader understanding of the domain. So there are different ways that you can get there and help your understanding. But if we really look back down to the requirements are that we do this. How we do it, that's up to your organization.
Correct. And just a correction, I did not say bad. I said it wasn't the greatest, but it
Yeah.
can get better. That's all.
Yeah, and to those, I really think that they're not reading the document properly. Like, it has everything that I wanted. It has leveraging. It essentially says like, hey, for equipment that yes, you apply the applicability, it becomes applicable. But then when it says what you can do, it's essentially just what you would do for good engineering practices that you control. You would have configuration management over it. So there's so much in this document if you actually take the time to kind of read it and understand it. And this is where critical thinking, there's strong sense and there's weak sense. Do you look at this document from weak sense and saying like, hey, I believe A, and I'm only going to review this document in the context of A. And there's like, doesn't say what I wanted. But if you take that step back and you read the whole thing without a bias and say, what does it actually say? It is a very powerful document. And if you need the translated version, I would go back to Data Integrity by Design, the CSA appendix there. So, I know we got 15 minutes left. Any questions, comments?
We see. Do we have any understanding of what the non-US regulators' comments are relating to the new guidance?
So I don't have privy of what their comments would be at this point in time. I think they're gonna go submit. Let me put it this way: read Annex 11. It just says that you need to justify it. I think it was at section, was that 4 or 5? The planning one? Is that 4 or 5? 5. It says that it says like, hey, you have to be able to justify it. That's no different than what scope and application said long ago. That you have a justified, we recommend that you have a justified approach. So we are not anticipating, we did do a lot of collaboration with A3P, which, French, but they were very early adopters into this. In fact, when we even went to speak with Dr. Sharon, they signed on as an organization endorsing CSA. So, I think it's favorable. And then if you look at, say, data integrity by design, I believe we have 2 FDA, 1 TGA, and 1 MHRA reviewer. When you look at the contributions page.
Well, it's a good comment.
Yeah.
And the reviewers.
And to that end, hi Rob, it's good to hear from you.
Hi, Charlie.
At the Australian regulator TGA actually did a GMP forum online last year, and it was one of the questions to them was, what was their position on CSA, and they had a very simple answer that's very similar to something Ken's already said in this session, which is, the regulations don't specify how to do validation. So whether you go through the most painful paperwork exercise or whether you take an enlightened approach with critical thinking and risk assessments and use CSA, that's none of their business. What they want to see is that you have done something that worked to validate it for intended use. Exactly what approach you took, whether you developed an alternative approach, that's not their issue. Their issue is the system fit for intended use? Did you carry out activities to give us that assurance? And as long as you did, they're perfectly happy with that. I will say, just as an off-the-cuff comment, the Japanese regulations actually do tell you how to validate. But most other regulations just tell you to do something as validation. And I thought that was a very, pragmatic response from TGA. We don't tell you how to do it. If it works, great.
So
Nice,
one day
that's
after
helpful.
CSA was, sorry, Rob, why don't you finish and I'll add a comment.
No, just say that those were helpful comments. Thank you.
And just to add on, one day after the CSA guidance came out, I believe it was already translated into Japanese. So I know the guy who did the translation. So hopefully Japan changes.
Another of those unofficial translations into and out of Japanese, because we never get official translations.
Yep. But they did reach out long ago to have conversations about it. I think India was definitely very, very receptive. We're kind of looking at the global stage. But again, France was very A3P, really took a thought leadership role in that. And again, this is our time to comment. This is our time to kind of put our own flavors and our own nuances for our own regions and make the document better. If there's something that we're missing, this is now the time to kind of ensure that we get those nuances captured.
Yep, I agree to that, and I agree also fully with you about the Annex 11. I want to add a comment. We also have got revision 1 of Q9, the quality risk management, and I think it supports also very well the approach that is in the CSA draft. So that's also an interesting document that supports the risk based approach, I think. So revision 1 is even better than the original Q9 on this. So we should not forget that.
Yep.
It will be interesting to see what the revision to Annex 11 brings, because some of the inspectors involved with that are very much at the more conservative end of the scale. So it will be interesting to see what it brings. Meantime, we have a hand up from Gianna. Please unmute.
Yes. Hi. Yeah, so I was just going to echo what was said before, that I actually don't think this is the finest guidance that was put out by the FDA. Again, there is room for improvement, and I think that's the benefit of having a comment session, is so that you can improve and make it as fine as it potentially can be. I think I was a little bit disappointed because it's kind of just saying things that we already knew, that you have to follow a risk-based approach, and that risk is functional and consequential to your own environment. So if you've understood GAMP, there's nothing new really in there, that the critical thinking has always been what you're supposed to be doing anyway. So I'm a little bit, I don't know, disappointed on that front. I think that a lot of people are going to start using CSA as a buzzword now, and forgetting that validation is still the word that is being used in the regulations. So we can't just drop the word validation anymore. That's one thing that I'm seeing with the customers that I work with, that everyone wants to rewrite their validation SOPs to call them CSA SOPs. I'm not sure we're ready for that yet, because the regulation still says you need to validate your systems, both from the FDA point of view and from European point of view. That word is still in use. And then, we heard a number of times already that the applicability of the guidance is not clear. So if my first comment that I would submit to the FDA is just refine that a little bit to make it clear, because if it's not clear who is supposed to be following this guidance, then you've failed in the adoption of the guidance. So that's my point of view on this.
Yeah, I think I would still take a different stance on where it's going. So maybe it's a good time to be a consultant if you can just rebrand and do a global substitution, CSA and CSV. Hey, Colette, I want to join your company later. I think it does go beyond from if you were to look at it, for example, the ability to leverage the activities of your developers and your suppliers. That was not there before in guidance. If you look at, say, like Annex 11, had that in there, right? In section 3.1, where it says you should treat IT analogously as your suppliers. It kind of, in its weird way, it brings, I think, the best of the other documents. I agree that it could be worded a little more precisely, but then guidance is guidance. Guidance is just a recommendation. And then when you take a step back, agency, again, we go back to the applicability. Agency has already said, for further guidance on validation across all centers, look to CDRH. That's in scope and application. That's been there since, what, 2003?
Yeah.
So I don't think, I think it's just people choose or
Yeah.
read what they want to read, and you will always encounter that because they always, give us the flexibility to define what we want to define, what makes sense for us. And then if you really go back down to it in the very beginning, Cisco said he didn't want to write this. He didn't feel that there was a need. Right, but industry kept asking for something. The same way with Part 11. We asked for Part 11. We got Part 11.
I mean, I think a lot of people really, really, really want this because it's very convenient. They now have a statement that allows them to do less work and not have to fight it with their internal quality teams or whoever is telling them that they need to focus more on compliance, like you said, and less on quality. But I mean, fundamentally, it makes total sense. Like,
You just did the same thing I did. Focus on quality, not compliance.
So just I just want to clarify one thing. When I hear the word less, we're not doing less work, right?
Yeah.
It
No,
really
you're
isn't.
absolutely right. But that's what people want. That's what they're wanting, and that's what they're hoping to get out of this. But at the end of the day, I don't really think much if you've had a very structured approach previously that followed the guidances that already existed, then I don't think this is going to be earth-shattering at all. And I don't think it's going to change much at all, because we should have already been doing a risk-based approach.
Well, unfortunately, I mean, GAMP has been talking about it for many years, right? Yet we always end up in testing everything. And well, we need to test everything, and we're documenting the heck out of everything. The idea here, test a lot more and document less. That's really the objective. And also what's really helping here, that the different testing approaches, that's definitely helping. That did not really exist before. It did exist in other industry, but for our industry, it was like a sin to do something called unscripted or ad hoc or exploratory testing, which of course you need to document, right? But again, I think this is just the tip of the iceberg, in my opinion, right? From a guidance perspective.
So a couple things. I don't think there was a guidance from agency that really goes super in depth on the risk-based approach. Scope and application, sure, it says, you have to have a justified approach. Here's the biggest thing. I'm going to be honest. I don't go to industry like validation conferences to learn how to test. I go to, say, Star West, DevOps, East and West. I go to testing conferences. I'm now telling you guys to go because if you went and you're not a practitioner, it'll probably be a waste of your money. You need to get a basis to be able to actually go to that conference and understand what they're talking about. GAMP does a great job of translating that and taking those technical aspects and giving you something that you can sink your teeth into without having to understand those subtle nuances now. But then it comes back down to, universal sizing, that it may not be best suited. Now, back to Colin's point, I test way more in my non-GXP test cycles than anything else, because we run thousands of test cases, and we don't waste our times. If you look at making just look at a protocol. You lump together so many scenarios together such that that protocol can never be reused again. And it's difficult to do a regression based on a protocol that can't be reused. So what we have opened ourselves up to is just basically modern software engineering technologies and techniques that can be applied such that we do better testing, higher quality testing, and we get the end result, which is higher quality systems. The compliance is tangential, but the compliance requirements, again, is that you did it. Right? We did that even with a lousy system, we did it. So the people who will cut corners, they're going to cut corners no matter what. They didn't need this as a justification. Those are people who risk assess everything away. That was my opinion, not that of ISP, or company, or compliance group, or any other organization. I'll get off my soapbox.
I do want to share with everyone just these upcoming webinars by the FIXA team. This is going to be a series. I will share the link on our CSA SIG. So, and also this schedule. You're going to have various folks from the industry speaking. Ken, you'll be speaking, at least a couple of them. We're also having a town hall October 21st. This is going to be in person in DC at the FDA. Actually, we're trying to align this because, again, the FIXA team, we're working ourselves on joint comment submission. So we're going to go through every section of it, elaborate on it. It's only 30 minutes. So it will be the folks from every organization talking about it. So I'll share that with you. Just wanted to let you know about it.
Cool. We
Got
have
one more hand up, I think, and then I guess we have to close.
Hi, it's Grace. I was just wondering if you were looking for additional members for the FIXA team.
I could not really say yes or no, but yes, I'm gonna say yes because I heard a female voice. So we definitely need to diverse. Again, unfortunately, a lot of the female in the FIXA team have moved on to other organizations, so they left the FIXA team. Please share your information with me, and I'll work with the team and see how where we can bring you in if the space is available.
All right, thank you.
Thank you.
Yeah, and I do think to Colette's point, there has been a strong female presence. Even if you look at the partnership with ISP Data Integrity by Design, we had Rachel, we had Shayna on the side. So it's an interesting thing. But Grace, I know you, so there are definitely people who have a voice and are willing to go out there are kind of key. But yeah, Colette, I don't know the mechanics of joining, because I remember when I joined, it was a very difficult thing to join.
It is, and that's why I don't want to promise anything. It has to be, a team approval, and again, it's just a matter of whether we have the spot or not. And I really don't know at this point, but I will definitely let you know.
Yeah, and I
Good
think
deal. Thank you.
Sure.
Do you think there are other opportunities? I don't think FIXA is the only way to get that voice. I really do encourage people to speak. I'm always looking for people to partner with to come up with content.
That I agree, actually. I think, in my opinion, this SIG right here, it has a much stronger future, and just the fact because we're the life science industry here, right? You've got pharma, biotech, med device, consulting, suppliers. I think this is, in my opinion, is a stronger phase for FIXA. But then again, FIXA is not that sexy, by the way. There's a lot of work you get assigned on a daily basis.
All right.
So
With that,
I guess Ken will close in a sec. So I'm just going to put in one more plug for, do think about commenting. Do pay attention to the guidelines and the deadlines for commenting and decide whether you want to comment as an individual to FDA, as part of your employer organization to FDA, or whether you want to submit comments through ISP GAMP, knowing that we will be quite judicious in making sure that these are comments that would really impact the guidance rather than just things you'd like to have. But also we've got the CSA SIG forum within ISP Engage if you want to put up questions and thoughts and discuss your impression of the CSA guidance with the other CSA SIG members. So please do be vocal. And sorry, Ken, for butting in.
no, that was good. I was just joining a different meeting on the other side at the same time. So I do want to thank everyone. I do encourage everyone to participate. I do think that this forum provides an opportunity for us to network, for us to bring ideas. I did enjoy all the questions and all the perspectives. I do like Grace coming up and wanting to be that voice. I think that we need to leverage and push, and we need to bring the perspectives and address the concerns that we're seeing to drive industry forward and make things happen. So with that, I'm going to close this session, and I believe, Lori, you're on deck for next month, I think.
Yes, I believe, but I don't think we have a final date yet.
Okay. And then do join us at the annual meeting. If you want FaceTime, it'll be a good time to talk with us. Charlie, Lori, myself, and Khaled will be there. So that'll be definitely time to talk and network. So thank you, everyone.
Thanks.
Thank you, Ken.
Thank you,
Thank
Ken.
you.
Bye.
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 Thank you. Bye.